Assalamu alaikum wa rahmatullahi wa barakatuh. We will continue our talk about the lower urinary tract symptoms. In this part, we are going to talk about the irritative lower urinary tract symptoms or the storage symptoms. Now, the irritative voiding symptoms, or which is the more commonly used term, is more correctly called storage symptoms because it indicates the failure of the storage phase of the urinary bladder, and it includes it can be due to irritation. That's why it is called irritative. The most common cause of irritation is infection or inflammation for other reasons, like is having cystitis, acute cystitis, prostatitis in male, having bladder stones also, or bladder cancer. Also, other conditions without having irritative cause, like overactive bladder due to a neurogenic cause, or sometimes chronic obstruction will end up with irritative voiding symptoms, but without irritation, it's due to chronic and long-standing obstruction. Now, the hallmark symptom in the irritative voiding symptoms is the urgency and urgent continence. Urgency is a sudden, compelling desire to pass urine that is difficult to defer it to another time, and it can be associated with urgency incontinence. Also, dysuria is simply painful urination. It is typically due to the most common cause of irritative symptoms, which is the UTI or any inflammation within the bladder, and the pain is often felt along the urethra, and as we know, also in the suprapubic area if it is involving the bladder. But it can be along the whole urethra, or it can be just referred to the urethral meatus or the distal part of the urethra. Now, frequency and nocturia in storage symptoms, they are different in mechanism than in obstructive symptoms. In obstruction, it is due to large post-void urine residues, while in irritative symptoms, it is due to bladder contractions, overactivity, or small capacity bladder that cannot hold large amounts of urine. Now, it's important in those cases to take a bladder diary. It would be helpful to determine if the urinary frequency due to incomplete emptying or overactive bladder, or due to polyuria, which is a medical cause. Polyuria can be due to polydipsia, either psychogenic or behavioral, or due to diabetes mellitus, diabetes insipidus, or other causes. Now, daytime frequency alone without nocturia may be due to psychogenic causes like anxiety or stress, which makes the bladder more overactive and got relieved during night, while having nocturia alone without daytime frequency may be due to increased in nighttime polyuria. Now, it's important also, hematuria is part of the voiding symptoms because it's important to highlight that irritative voiding symptoms, particularly in patients older than 50 years of old with smoking history and having hematuria, uh, occult bladder cancer, that what we call it carcinoma in situ, CIS. It's a high grade by definition, so it can be invasive, and it can present with only irritative voiding symptoms. So, in patients with persistent lower urinary tract symptoms, especially the irritative symptoms, without obvious cause like UTI, like having bladder stones, or having a neurogenic condition, it's important to do cystoscopy and to take biopsy from abnormal areas or random biopsies to rule out carcinoma in situ, because it's an important or maybe the most important cause for irritative voiding symptoms. Finally, thank you for listening to this series. Hopefully, we will meet again in another series like talking about genital or genital tract symptoms and organs. Thank you.